Contraindication is something that can restrict or prevent a treatment from being carried out. A therapist needs to be familiar with certain conditions so they can prevent cross-infection and further harm to their client from themselves and their future clients. Conjunctivitis is the inflammation or swelling of the conjunctiva. Possible symptoms include redness in the white of the eye or inner eyelid, increased amount of tears, a thick yellow discharge that crusts over the eyelashes, especially after sleep, green or white discharge from the eye, itchy eyes, burning eyes, blurred vision, and increased sensitivity to light. A stye is a small painful lump on the inside or the outside of the eyelids. Possible symptoms include a painful yellow lump on or in the eyelid, redness of the eye or eyelid, a watery eye in some cases. Blepharitis is a common condition where the edges of the eyelids become red and swollen. Possible symptoms include itchy, sore and red eyelids that stick together, crusty or greasy eyelashes, a burning gritty sensation in your eyes, increased sensitivity to light, swollen eyelid margins, finding contact lenses uncomfortable to wear, abnormal eyelash growth or loss of eyelashes in severe cases. Cold sores near the eye. Possible symptoms include pain in and around only one eye, headache and fever, redness, rash or sores on the eyelids and around the eyes, especially on the forehead, redness of the eye, blurry vision, and swelling and cloudiness of the cornea. Black eye or bruising to the area. Possible symptoms include the skin around the eye goes a blue or purple colour after the bursting of blood vessels under the skin. Skin may also be swollen and vision affected. A black eye isn't usually serious and will clear up after around 2 weeks. Other contraindications include fever, contagious or infectious diseases, under the influence of recreational drugs or alcohol, diarrhea and vomiting, allergies to products, eczema, undiagnosed lumps and bumps, localised swelling and inflammation, any cuts, bruises and abrasions, watery eyes, scar tissue, sunburn, hormonal implants, recent fractures, a minimum of 3 months, sinusitis, migraine or headaches, Botox and dermal fillers at least 1 week following treatment, and hyperkeratosis. During lashing, you'll find that there are contraindications that don't stop the treatment, but you can work around them. These treatments include medical edema, nervous and psychotic conditions, epilepsy, recent facial operations affecting the area, diabetes, you may need a doctor's note, skin cancer, a slip disc, undiagnosed pain. Some medications could affect your eyelashes, whiplash. It's always important to check with your client that they're also comfortable lying down still for about 2 hours during your treatment. If you think that your client has a contraindication, it is important that you do not diagnose them with the condition that you think it may be, as you are not a trained medical professional and are not in a position to be able to do that. If you think that your client has a contraindication, you should inform the client that they may have a possible contraindication and that you cannot carry out the treatment as it may cause harm to the client. If they still wish to have the treatment, inform them that they should get a doctor's note or reschedule their appointment to when their condition is expected to disappear. Be professional and reassure your clients. If possible, offer an alternative treatment that is not contraindicated. Always record your findings on your client's record card for future reference. A contra-action is a reaction possibly caused by a treatment that is being carried out. If you are allergic to something, you will have what is called an adverse reaction. When a person experiences an adverse reaction to a substance or a chemical, it is necessary to remove the product or irritant from the body. Medical advice should then be sought if symptoms persist for more than 24 hours. It's always wise to carry out a patch test for your clients. Doing a patch test doesn't necessarily mean that they're not going to have an allergic reaction, but it's a precaution. To patch test for eyelash extensions, cleanse the eye using a water-based eye makeup remover. Apply micropore tape to the bottom lashes. Apply 2 to 3 lashes to the corner of each eye. The glue must not touch the skin. Advise your client to keep their eyes closed for at least 5 minutes or use a fan to blow away the fumes. Record details of your patch test on your client's record card.